Good afternoon. Today we're going to give an update on our plans to continue to support school districts, administrators, and teachers here in the Commonwealth and kids with respect to COVID-19 testing resources. But first I want to give a quick update on the COVID-19 testing cases and hospitalizations here. The Department of Public Health yesterday reported over 19,500 new individuals who've been tested for COVID-19. As we said earlier this week, we've seen a steady and consistent increase in the number of people tested compared to the spring and early summer. Yesterday, there were 262 new positive cases reported, which brings the total since the beginning of the pandemic to 115,048. The 7-day average test for positive test rates in Massachusetts remains at 1.4%. There are currently 365 patients that are hospitalized for COVID-19 statewide, and 66 of those are in the ICU. Those are pretty similar to the numbers we've had for the past couple of weeks. As of yesterday, 2 hospitals are using surge capacity. Yesterday, DPH also issued its weekly update to our enhanced COVID-19 community-level data map. That data can be accessed on DPH's weekly report or at mass.gov/COVIDmap. The new weekly data indicates that 16 communities have moved from moderate to low risk status. That's a move in the right direction, and it's good to see. Meanwhile, Holyoke and Hull moved from high to moderate risk categories, and Granby went down under 5 cases, and so they moved into the unshaded white category. Brockton, South Hadley, and Winthrop moved from moderate risk to high risk. Obviously, we're going to see a little movement week over week with a handful of communities who are somewhere near the dividing line between the 2 different categories. But everyone in those high-risk communities, and we've been talking to them pretty regularly, needs to be aware that their community is seeing an extremely high rate of transmission and take appropriate precautions. That means being vigilant about outdoor gatherings and private events. It means wearing a mask and avoiding, to the full extent possible, situations and circumstances where you won't be able to social distance. And obviously, if the contact tracing team calls, they need to pick up the phone and answer it. We are far from not powerless in this fight, and we need to continue to do the things we know we can do that can contain the virus. Overall, compared to the previous 2-week period, 73% of communities had either seen an improvement or no change in their average daily case numbers, and we're glad to see that the vast majority of communities in Massachusetts have not seen an increase in transmission, and that we're seeing positive changes as well in many places. The map featuring comprehensive community-level data is a valuable tool, obviously, as we start to get close to the new school year. As of yesterday's report, 314 of the 351 cities and towns in Massachusetts are reporting an average daily case rate of less than 4 cases per 100,000 or less than 5 cases total in the entire municipality for the past 2 weeks. That means the vast majority of our communities fall into the so-called green and white categories and are experiencing next to no viral spread. Given the low transmission rates in the vast majority of our communities, we're glad that nearly 3/4 of our school districts are using the categories as they plan to either offer a full return or an in-person learning or hybrid approach to their kids. This guidance and the metrics that guide it are based in science. They were developed with our colleagues in the pediatric and infectious disease community, and they're also consistent with ones that are being used in other states and in some countries as well. Commissioner Jeff Riley and his team at the Department of Elementary and Secondary Education work collaboratively with public health experts and medical professionals to follow the science to create these guidelines in the first place that are designed to make sure that we do put our students and our teachers first. These guidelines and the plans recently submitted by school districts are all about the public health measures that we know work: face coverings, hygiene, sanitization, and distancing, which have been in many respects the cornerstones of our efforts and the efforts in many other places to reduce the spread and get to the point where we can start to think about a new normal. The implementation of these safety measures, combined with the low transmission rates we have here in Massachusetts, mean that for most students, and their families, in-person learning is an option that they can pursue. We recognize that new cases of COVID-19 have occurred in people under the age of 18 over the past several months, and there will probably continue to be cases among people under the age of 18 going forward. Preparing for these cases, allocating the resources to respond to them, and doing what we can to prevent them in the first place is why we developed these detailed school opening plans. And until there's a medical breakthrough like a vaccine, COVID will be a part of our lives that we must find a way to deal with accordingly. As we've said before, it's not going away this summer, it won't be going away this fall, but neither is our obligation to do what we need to do for kids here in the Commonwealth, especially when it comes to their social development and their education. It's taken a lot of work and a lot of time and a lot of resources, but school districts across the Commonwealth are following through on that obligation and opening their schools based on intelligent, responsible plans that are driven by the science. To help schools get ready, our administration has provided comprehensive, science-based plans on everything from transportation to sports and, of course, classroom configuration. We've also made available nearly $1 billion in federal funds on top of a modest increase in permanent funding with respect to the state's K-12 funding program, as well as level funding on unrestricted general government aid to cities and towns. And we've worked to develop new community-level data to help guide district decisions. Another resource to assist schools we're making available will be new COVID-19 testing tools that can be made available to every school in the Commonwealth. First, we'll implement a rapid response testing program for K-12 schools across Massachusetts. This program will be designed to quickly deliver testing resources for students and school personnel if there are multiple cases in a cohort that require larger scale testing than a community may have access to currently. This program can be deployed to test students within a particular classroom or other groups. A local health department and the Department of Public Health at the state level will work with a local school district to determine if certain conditions are met and that this program should be deployed. The Department of Public Health and the Department of Elementary and Secondary Education will put out detailed guidance in the coming weeks around how this process will work on the ground. The testing program is not a replacement for necessary testing for students and staff who are symptomatic. As we've been saying for months, if you feel sick with COVID-19 symptoms, you should stay home and you should certainly not go to school or go to work. Students who develop COVID-19 symptoms or are identified as close contacts through contact tracing programs should be tested by their healthcare provider or at a COVID-19 testing site. The Commonwealth is one of a handful of states that's leading the nation in ensuring widespread access to testing resources. There are currently hundreds of test sites across Massachusetts, and thankfully, the average turnaround time for Massachusetts is about 2 days. The weeks-long delays that we've been seeing elsewhere in the country simply are not the norm here in the Commonwealth. The second tool we're announcing is a significant expansion of our Stop the Spread testing initiative. This initiative was launched earlier this summer and currently provides free testing in 20 communities that have high rates of COVID-19. The testing sites made available through the Stop the Spread initiative are open to anyone in the Commonwealth, including people who are asymptomatic. As schools get underway, we want to ensure that we continue to have robust testing capacity, especially in communities that need it the most. That's why we'll continue this Stop the Spread initiative in several communities with the highest rate of COVID through the end of September. As I said earlier, in addition to Stop the Spread testing sites, the Commonwealth has a network of hundreds of testing sites in communities across Massachusetts. You can visit mass.gov/gettested to find a site that's near you. These testing resources for school districts are another tool to keep students and staff safe when kids return to the classroom in the fall. And as with everything that's COVID-related, there is no silver bullet. We must use every tool that's available to continue to contain the virus. Wearing masks, practicing good hygiene, avoiding large groups, maintaining distance whenever possible, testing and tracing. Taken together, the science makes clear that this is how you fight the battle against COVID. And as I said before, it didn't take the summer off, but neither did the people of Massachusetts, and on the whole, we're effectively bringing the fight to the virus, and that's why we've been able to continue to open up businesses and get back, in many respects, to something like a new normal. It won't be taking the fall off, but neither is our responsibility to do everything we can to make sure that our kids continue to thrive. By working together and putting the needs of the children first, the adults can do their jobs and help kids get the education that they deserve.